This session focuses on the application of informatic methods to public health surveillance. The availability of clinical information for public health has been fundamentally changed by the introduction of the electronic health record and health information technology, which now give public health an unprecedented opportunity to leverage the information technologies and standards to support critical public health functions such as alerting and surveillance. At the end of this session, you will be able to describe informatic tools for promoting community and population health and define the roles of federal, state, and local public health agencies in the development of public health informatics. The core public health functions are the assessment and monitoring of the health of communities and populations at risk to identify health problems and priorities. The formulation of public policies designed to solve identified local and national health problems and priorities, and to assure that all populations have access to appropriate and cost-effective care, including health promotion and disease prevention services, as well as evaluation of the effectiveness of that care. Public health is a field that encompasses an amalgam of science, action, research, policy, advocacy, and government. Historically, John Snow can be designated as the father of public health informatics. In 1854, he plotted information about cholera deaths and was able to determine that the deaths were clustered around the same water pump in London. He convinced authorities that the cholera deaths were associated with that water pump. When the pump handle was removed, the cholera outbreak ended. It was Dr. Snow's focus on cholera-affected population as a whole, rather than on a single patient, that led to his discovery of the source of the cholera outbreak. Florence Nightingale should also be recognized as an early public health informaticist. Her recommendations about medical reform and the need for improved sanitary conditions were based on data about morbidity and mortality that she compiled from her experiences in the Crimean War in England. Her efforts led to total reorganization of how and which healthcare statistics were collected. Just as information has been recognized as an asset in the business world, so healthcare is now recognized as an information-intensive field requiring timely, accurate information from many different sources. Health information systems address the collection, storage, analysis, interpretation, and communication of health data and information. Many health disciplines, such as medicine and nursing, have developed their own concepts of informatics, integrated computer information, and cognitive science with the science of the professional domain. That trend has reached the field of public and community health. The Institute of Medicine defines the role of public health as fulfilling society's interest in assuring conditions in which people can be healthy. Functions of the public health include prevention of epidemics and the spread of disease, protection against environmental hazards, promotion of health, disaster response and recovery, and providing access to care. Specifically, health care. The initiative of integrating the healthcare enterprise to ensure that healthcare information can be shared more easily and used more effectively has inspired the creation of the domain known as quality research in public health. Participants in this domain address the repurposing of clinical, demographic, and financial data collected in the process of providing clinical care to monitoring of disease patterns, incidence, prevalence, and situational awareness of such patterns, and the identification of new patterns of disease not previously known or anticipated. Such data can be incorporated within existing public health population analyses and programs for direct outreach and condition management through registries, and locally can determine appropriate treatment programs or protocols. As the public becomes more aware of harmful elements in the environment, risk assessment tools have been developed. Such tools allow assessment of pesticide use, exposure to harmful chemicals, contaminants in food and water, and toxic pollutants in the air to determine if potential hazards need to be addressed. A risk assessment may also be called a threat and risk assessment. A threat is a harmful act, such as the deployment of a virus or illegal network penetration. A risk is the expectation that a threat may succeed and the potential damage could occur. Risk factors assessments complement vital statistics data systems and morbidity data systems by providing information on factors earlier in the causal chain leading to illness, injury, or death. Health risk assessments are used to estimate whether current or future exposures will pose risks to broad populations and are used to weigh the benefits and costs of various program alternatives for reducing exposure to potential hazards. They may also influence public policy and regulatory decisions. Health risk assessment is constantly developing process based in sound science and professional judgments. There are usually 4 basic steps that are ascribed to risk assessments. The first, hazard identification, seeks to determine the types of health problems that could be caused by exposure to a potentially hazardous material. 2, exposure assessment is done to determine the length, amount, and pattern of exposure to the potentially hazardous material. 3, dose response assessment is an estimation of how much exposure to the potential hazard would cause varying degrees of health effects. And 4, risk characterization is an assessment of the risk of the hazardous material causing illness in the population. The overall question the risk assessment has to answer is, how much risk is acceptable? Risk factor systems are used throughout the United States and may be local, regional, or national in scope. Specific risk assessment tools exist for specific health issues, such as Suicide Prevention Community Assessment Tool. This addresses general community information, prevention networks, and the demographics of the target population and community assets and risk factors. Other risk assessment tools include the Youth Risk Behavior Surveillance System, the Behavioral Risk Factor Surveillance System, and the National Health and Nutrition Examination Survey. Determining the presence of risk factors in communities is a key part of a community risk assessment. Communities may be concerned about which elements in the environment affect or may affect the community's health, the level of the environmental risk, and other factors that should be included in public health planning. Ball in 2003 defined value as a function of cost, service, and outcome. The value of a community risk assessment derives from its ability to provide information crucial to planning, build a consensus regarding how to mobilize community resources, and allow for comparisons of risks with those of other communities. The goal of a community risk assessment is risk reduction and improved health. A community risk assessment may identify unmet needs and opportunities for action that may help set new priorities for local public health units. It may also be used to monitor the impact of prevention programs. There is a need to define the role of federal, state, and local public health agencies in the development of public health information and IT applications. The availability of IT today challenges all stakeholders in the health of the public to adopt new systems that can provide adequate disease surveillance. It also challenges people to improve outmoded processes. Preparedness in public health requires more timely detection of potential threats, situational awareness, surveillance, outbreak management, and countermeasures, as well as response and communications. Surveillance uses health-related data that signal a sufficient probability of a case or an outbreak that warrants further public health response. Although historically syndromic surveillance has been used to target investigations of potential infectious cases, Its uses to detect possible outbreaks associated with bioterrorism is increasingly being explored by public health officials. Early detection of possible outbreaks can be achieved through timely and complete receipt, review, and investigation of disease case reports. By improving the ability to recognize patterns in data that may be indicative of a possible outbreak early in its course, and through receipt of new types of data that can signify an outbreak earlier in its course. Such new types of data might include identification of absences from work or school, increased purchases of healthcare products, including specific types of over-the-counter medications, presenting symptoms to healthcare providers, and laboratory test orders. The University of Pittsburgh Real-Time Outbreak and Disease Surveillance Laboratory, for example, developed the National Retail Data Monitor System. The National Retail Data Monitor System collects data on over-the-counter medications and other healthcare products from 28,000 stores and uses computer algorithms to detect unusual purchase patterns that might potentially signal a disease outbreak. A comprehensive surveillance effort supports timely investigation and identifies the need for managing the public health response to an outbreak or terrorist event. Informatics tools are becoming increasingly important in these public health efforts. Information is vital to public health programming. The data processed into public health information can be obtained from administrative, financial, and facility sources. Included in this data stream may encounter screening, registry, clinical, and laboratory and surveillance data. It has been recommended that the functions of population health beyond surveillance be integrated into the EHR and the personal health record. Such an initiative might allow population-level alerts to be sent to clinicians through electronic record systems. Systems are now being developed to allow for automated syndromic surveillance of emergency department records and media surveillance, which in turn supports the early detection of potential pandemic occurrences. Such systems were tested during the 2009 H1N1 flu outbreak. The Public Health Enhanced Electronic Medical Record can provide immediate detection and reporting of notifiable conditions. The incorporation of geographic information allows public health data to be mapped to specific locations that may indicate an immediate need for intervention. Vital statistics from state and local governments are used for public health purposes. It should be noted that databases created with public funds are public databases that are available for authorized public representatives for public purposes. Widespread implementation of EHRs is likely to facilitate the concept of a public health-enabled record, which can automatically send patient information alerts from point of care to public health departments when reportable symptoms, conditions, or diseases are encountered. A public health-enabled EHR can be bidirectional, allowing public health information and recommendations for treatment to be accessible at the point of care. One public health EHR prototype addresses the information flow related to newborn screenings. They include syndromic surveillance using data generated from mandated and non-mandated laboratory results, physician diagnoses, and emergency or clinic chief complaints, strategies to locate loved ones in mass casualty events, and public health alerts at the individual and population levels. The availability of data and the speed of data exchange can have a significant impact on critical public health functions, such as disease monitoring and surveillance. Currently, surveillance data are limited and historical in nature, although this situation is rapidly changing. Nevertheless, special data collections are needed to address specific health issues, and investigations and emergencies are still frequently addressed and managed with paper. In the future, public health information will make real-time surveillance data available electronically, and investigations and emergencies will be managed with the tools of informatics. Surveillance data systems such as infectious disease trackers that collect data on adverse health effects are invaluable tools for public health officials to tap for planning, evaluation, and implementation of public health interventions. Syndromic surveillance for early outbreak detection is an investigational approach where health department staff, assisted by automated data acquisition and generation of statistical signals, monitor disease outbreaks, disease indicators continually, either real-time or at least daily, near real-time, to detect outbreaks of diseases earlier and more completely than might otherwise be possible with traditional public health records. Traditionally, there have been no common infrastructure to respond to pandemics, but the development of health IT is creating opportunities that go far beyond national boundaries to impact global health initiatives in the public. In New York City, a primary care information project funded by the CDC has developed a multifaceted initiative, the Center for Excellence in Public Health Informatics, to address the issues of measurement of meaningful use, disease and outbreak surveillance, and decision support alerts at the point of care. Improvement of community health status and population health depends on effective public agencies. There is now interest in the capture of information from hospitals, pharmacies, poison control centers, laboratories, and environmental agencies. Timely collection of such data allows early detection and analysis. The literature identifies the RAND changes still facing public health informatics as the development of national public health information systems, a closer integration of clinical care with public health, and concerns of confidentiality and privacy. Population health data must be considered an important part of the infrastructure of all regional health information exchanges, which are the building blocks for National Health Information Network. Organizations and agencies interested in promoting and protecting the public health must commit to collaboration and seamless data sharing. Public health data include data related to surveillance, environmental health, and preparedness systems, as well as client information, such as data from immunization registries and laboratory results reporting and analysis. These types of data can provide information about outbreaks, patterns of drug-resistant organisms, and other trends that can improve the accuracy of the diagnostic and treatment decisions. A regional health information exchange and national health information network can also support public health goals through broader opportunities for participation in surveillance and prevention activities, improved case management and care coordination, and increased accuracy and timeliness of information for disease report. Much of the information presented here is focused on reaction to issues and timely intervention rather than harnessing information technology for disease prevention. Fuller in 2001 has advocated for a shift to prevention informatics by harnessing real-time social data and aggregating and representing these data in a meaningful way so that an appropriate prevention response can be mounted. For example, internet searches related to flu symptoms might prompt a public health prevention response such as a school closure to minimize spread. Newer software tools to support mapping and real-time data visualization supports the gathering of distributed data from the web and other data streams. Prevention informatics offers a useful paradigm for reimagining health information systems and for harnessing the vast array of data, tools, technologies, and systems to respond proactively to health challenges across the globe. Harnessing data from the social medias such as Twitter or Facebook provides yet another example of using citizen-generated or crowdsourcing in community health. Merchant, Elman, and Lurie in 2011 have described how data mining generated in social media can improve response to mass disasters by helping responders locate people who need help and identify areas where to send resources, build social capital, and promote community resilience post-disaster. Tweets and photographs linked to timelines and interactive maps can tell a cohesive story about a recovering community's capabilities and vulnerabilities in real time. These authors caution, however, that the social media should be used to augment or improve, not replace, current disaster response and communication systems, as not all communications in social media are entirely trustworthy. Public health informatics strives to ensure that evolving health data systems will meet the needs of all organizations interested in population health as national and international standards are developed for healthcare data collection. This includes standardization of environmental, socio-cultural, economic, and other data relevant to public health. The future of practice in public health depends on how efficiently and effectively public health data are captured, analyzed, and disseminated for regional, national, and global health planning and management. In an ideal world, we would see seamless data collection and sharing and a commitment to global health planning. The International Council of Nursing Code of Ethics states, the nurse holds in confidence personal information and uses judgment in sharing that information. The expanding use of new technologies in healthcare will bring about challenging ethical issues. Consider that patients in health no longer have to be in the same place for care.